Great.
Yes, it
That's
was. And,
great.
I've had many mentors along the way. Dr. Francis Shepard is my lead mentor in lung cancer. My start in RWE actually, though, didn't come from Dr. Shepard, does a lot of clinical trials, but is also very interested in translational research. It actually came from Professor Martin Tattersall, whom I worked with. He was very interested in communication with patients, what patients understood. And that really introduced me to the whole world of health services research and outcomes research, which I found very fascinating. I think drug development is critical. I think clinical trials are critical in that translational aspect, so we can understand the biology of the disease and how to make an impact. These are all essential. But the other things that were really important to me was, how does the system work? Are our patients treated fairly by the system? Are there things that we need to fix? Who are we as oncologists? How does our understanding and our behavior impact on our patients? And what needs to be changed to make things fairer and better to make sure that everybody can take advantage of progress?
So so keeping that in mind, because I think that's a relatively unusual sort of a research focus for a lot of oncologists. I think when we talk to people, they're really laser focused on the therapies, on clinical trials, especially really trying to put through rigorous testing potential therapeutic options for patients. Health services is a little bit surprising. Is there anything about your approach to oncology that people might find surprising?
Thanks. I don't think so. At the time, when I started just over 20 years ago, health services research was not where it was at. I found it fascinating, the study of
Hmm.
us, the study of the system, the study of patients outside of trials, that chance to really make things better for every patient. That really meant a lot to me at a personal level, at the level of an oncologist and a healthcare provider. I will say in the last 20 years, now that's most commonly what people come to me with. People are interested in outcomes. When I
Yeah.
first started, Dr. Shepard launched my career in pharmacoeconomics, which was very unpopular for most of my career. And now it's the big thing. So I kind of feel like I started all this when it was very unpopular and very difficult. But it's nice to see that it's of so much greater interest. And there are many more people, making their careers and really making advance in this area.
That's terrific. Yeah, and I can empathize with you on that. I started on that same path probably around the same time, and it was I'd say not a hard slog, but it was really uphill trying to convince people that there was a complete other side to the health system that really needed examining if we were going to make it not only the most effective we could make it, but sustainable as well, which I think was the other piece that a lot of people started to become concerned about and really wanted to understand.